first story, what's happening right now is public health experts are stating this. Single-payer systems coping with Covfefe 91.
You can say it.
Oh, coronavirus, might as well. Rip that Band-Aid off. More effectively than a for-profit model. What? Oh my God, Dan, you're crazy. Shut up. Come on, man. So as the coronavirus pandemic extraordinarily puts a strain on national healthcare systems around the world, public health experts are making the case that countries with universal single-payer systems have thus far responded more effectively, more efficiently to the outbreak than nations like the United States. But guys, I always thought we were number one. Rahm Emanuel said that no one's running up to him saying, get rid of my health insurance.
If I see him, I'm definitely going to run up to him and say that.
Yeah, I'm going to be yelling loudly in his face because he deserves it. Whose fragmented for-profit apparatus has struggled to cope with the growing crisis. And you want to know why it's struggling? Because we have money in politics. Because of Citizens United, because of this decision, not only is the prison-industrial complex, military-industrial complex running amok and buying our politicians, but there's also the pharmaceutical industry and the healthcare insurance industry, which, guess what? They like the system the way it is. They like putting people in medical debt. They like seeing people suffer. Daniel did a story just a few weeks ago about how you have just a simple couple in Kentucky, normal folks. I don't know what their political affiliation is, but guess what? They're going to go to jail because they didn't pay their medical bills. Oh, wow, Class A criminals. I'm glad that those bad people are behind bars. In what world?
But I thought debtors' prisons weren't a thing in America.
So here's the thing. So this is what's going on.
Branded.
So right now, unlike the United States, this is from a post from the Washington Post, of all places. Unlike the United States, where top health officials told Congress the rollout of testing was failing, where Congress is now moving through a bill that includes free testing, the single-payer countries have been especially nimble in making free and low-cost virus screening widely available to patients with coughs and fevers. And in fact, countries with forms of single-payer healthcare, like South Korea and Denmark, have for weeks been offering drive-through testing and other innovative mechanisms, allowing them to quickly test hundreds of thousands of their citizens and respond accordingly. So,
how are they going to pay for it, though?
Exactly. We're able to bail out the banks. We're able to bail out Wall Street. We're able to have money for these endless wars. We're able to have tax breaks, but we can't take care of our people. We are the richest. We might not be anymore, but we have been told, we have this, image of being the richest, most powerful country in the world, strongest military, best thing ever, and we can't take care of our people. What kind of country is it that cannot provide shelter or health care for its people, but yet we have money for endless wars? That is an embarrassment in the United States. And there's a lot of things to be prideful for this country, but as of right now, let's look at our real history. Let's look at what's happening right now. Right now, you have citizens basically panicking because there is no system in place to take care of them. They're relying on their health insurance companies that are basically, supposed to take care of them. But you know what? At a drop of a dime, those insurance companies will drop their people and still charge them because guess what? They have the RNC and DNC in their back pockets. This is inept and wrong. People are going to be suffering, and we only have just entered into this crisis. Right now, this is a nationwide crisis. It is breaking the system, and our current health system doesn't work. We're seeing fractures into it. Hell, we're going to see that system break apart. We don't have enough ventilators. We don't have enough hospital beds. We don't have enough staff. We don't have enough of anything. I thought this was a country that had so much money. We had money coming out the butt, I was told. But I guess we don't. I guess we can't take care of our people. Now, the thing is what I want to tell all of average Americans. I don't care what your political affiliation is. Aren't you upset that this has been allowed to go on? Aren't you angry that finally, when the United States is given this epic challenge, the likes of which we have never seen, our government and health system, our healthcare system is failing miserably? You should be angry. You should be foaming at the mouth. You should be screaming from the rooftop. We cannot go back to this system ever again. Do you really trust the people in Washington, D.C. and your health insurance agencies to really look after you after all of this? No, we shouldn't. Everyone deserves dignity. Everyone deserves Medicare for all. Everyone deserves not to get sick. Everyone deserves to make sure that they have a safe place to go to. Medical debt is an embarrassment in this country, and we've been allowing this to happen for too long. Well, never again. The rest of the world supposedly looks to the United States for leadership. The rest of the world looks to us as this great bastion of liberty and freedom. Once this crisis passes, and it will pass, Do you really think the rest of the international community is going to look at us as pride and leadership after what this country has done to its own people? Probably not. Dan, Paul, take it away.
Yeah, so this is the cost of the system we've had. At Hardlands Media, ever since we've gone on air, even back in radio, especially back in radio, I suppose.
The radio days, yep.
We have been predicting a confluence of events such as this occurring and the complete inability of the government to do anything about it because of the way it is organized. Right now, we're at a spot where we laugh and yell at these, terrible socialist countries, and they can't even stock food on their shelves. We can't either because of a virus that's moving through. We're shutting down our country. Our economy is collapsing at the very idea of people not leaving their house for a period of time. That's not stability. That's a house of cards that is in the middle of collapsing. And we, here at Hard Lens, have been saying it for years. And what have we gotten from you guys? You guys understand what we're saying. You guys come to us most days in the week that you're available to do so. You watch our clips and you say, yeah, this seems pretty reasonable. Why is no one else saying it? But what have we gotten from the mainstream? We're told we're insane. We're told we have no idea what we're doing. The system is fine. It can never break. You guys are just anarchists. You guys are just this, that, the other thing. We're going to attack you. It turns out we were right. We were all right this entire time. The obvious was correct. And the people who made money off the system, who make money off the system, were indeed mortgaging the lives of you and your friends and your family and other people you don't know so they can continue making a buck because they believed in a system that was inherently poorly built that can't even stand to a little pandemic. Now, I'm not sure if I'm asking too much, but I really do believe that a strong economy and a strong country should be able to survive a pandemic with, effects, but not a complete collapse like we're about to see. You talked about Norway, you talked about Korea. They immediately go, okay, there's a problem. We're going to make sure we test everyone. We're going to go through tests. One really cool thing that Korea found out is that the prevalence of coronavirus in young adults, like around our age, is actually astronomical, but there's no symptoms because of the age. Now, if you go to places like America, well, you have to first get your insurance company to okay it, and they're only going to okay it if you're showing symptoms. So there you go. I'll knock that entire age bracket out of there. And if you're near someone, you're near a number of people that show symptoms, that's not enough. You have to show symptoms yourself, which means you only can get tested once you've had it for about 2 weeks. Mm-hmm. That's the system we have. Look at that, working wonderfully.
I think the only exemptions to that are like if you were in a country recently coming into the U.S. that had things like that.
And so that's the system that is so perfect that we were so wrong about to question. How dare we question the thing that we were ultimately right about? Here's the reality. Hardlands gets this right because it's obvious. It's reasonable. It's what the data shows. It's also what science shows, something that they like to talk about when it comes to global warming, but not things such as this. Mm-hmm. The reality is the government's failed you, but you already know that. The rich have failed you, but you already know that. This is the culmination of the obvious. It just needed a small little spark to set it off. But here we are. In a situation, sadly, and because I've said this on the show a number of times, that I expected this collapse to happen at the beginning of the year, the election would have been very different.
It would have been.
Had this happened
Absolutely.
3 months ago.
Right.
Sanders would be the leader. But here we are.
Hold on, Paul, what's your comments?
And I wanted to, I'm sorry if I'm going to take these from you, but I wanted to read...
the Super Chats?
Yeah, these Super Chats, because they're great. First of all, Ben Riley mentions, thank you for the $2, by the way, Ohio just pushed the election back. That's an appropriate thing to do in a time of health emergency like this, to basically wait until we can get a handle on it before we ask people to...
It might happen here in our state, too.
Yeah.
It has yet to be announced.
But
we have
but that's
like less than 24 hours for them to announce something
that's
like that.
That's an anti-American sentiment, though, Paul.
Yeah, but to encourage civic engagement. Sarah Hughes, though, says a university in Norway is telling its students in the U.S. to come home due to poor healthcare system and poor infrastructure. That's telling. Yeah. And I wanted to point out, this was discussed during the debate last night, actually. And Joe Biden was trying to say, look, countries that have some sort of single-payer universal healthcare system, like what Bernie Sanders is talking about with Medicare for All, haven't been able to avoid this health crisis, haven't been able to do any better. And this is experts right here telling us, no, Joe, that's wrong.
Yeah.
They have done better. Systems that have infrastructure that allows for people to come in and get tested and receive treatment regardless of their age and showing symptoms, and if their proximity to countries that have shown prevalence of the virus. That's the kind of thing that's like, well, hey, maybe that's a good idea to test everyone and have a universal healthcare system. Maybe it's good to have robust healthcare infrastructure for this specific type situation. It's a prime example of why that's an excellent thing. And we already know from exit polling, we've reported on this here already, that the majority of Democratic primary voters across every state that's voted so far overwhelmingly support Medicare for All as a policy platform. So it feels a little bit like preaching to the choir, because we all know this is true. This is the case, that our healthcare infrastructure and system would be better for all Americans if we had some kind of single-payer universal healthcare system, and Americans demonstrably want that.
And I want to add on that the other here. This is like a thing I really got to me last night when Joe Biden was talking. Joe Biden literally pulled the Venezuela card, not with Venezuela. He literally went to, okay, let's look at all the single-payer systems in the entire world. I'm not going to talk about South Korea's. I'm not going to talk about what Norway did. I'm not talking about Scandinavia. I'm going to talk about the one that's in the news for being bad, which is Italy. What an ass. What an utter ass to do that. He's taking, again, he's literally pulling the Venezuela card. He's saying, I'm gonna hit single payer in the country of all the. It's the same thing. You guys get what I'm saying. Now here's the other part of it. It's not just about single payer. If you are laid off, like let's say right now, there's a lot of people that are not at work right now because their business closed for whatever reason, right? If that's happening in Italy, which it is in the places which are quarantined, you know what happens with them? They're getting paid a portion of their wage right now. They have health care that they can go to. Maybe they're not having, it's not the best well-organized single-payer system out there, but they have health care they can do. They're not going to go bankrupt from their health care. They don't have to wait for the insurance company to approve them either. And once they go back to work, they're fine. They're going to have money that they're getting. They're not going to be destitute. No one's going to be kicked out. You know what's happening in the U.S.? That fast food worker that is paycheck to paycheck, who is basically at this point 50% of the country, when they get laid off, even though that there's like even Illinois, oh, we're not going to charge them for rent or that or this or the other thing. Once this is lifted and you've accrued $3,000 in backed rent that you can't pay because you no longer have a job because you're laid off and the country's in depression, it's a very different situation.